Waking with a racing heart? 4 triggers to stop tonight? Most people think waking up with a racing heart means something terrible is happening. You open your eyes in the dark. Your chest is pounding. Your heart feels fast, strong, or fluttery. You may feel hot, shaky, thirsty, anxious, or short of breath. And the first thought is usually, is this my heart? Is something wrong? Now that fear is understandable. Your heart is not something you want to gamble with. But here is where people get fooled. A racing heart at night does not always mean a heart attack. And it does not always mean a dangerous rhythm. Sometimes it is your body reacting to something you did hours earlier. Sometimes it is sleep disruption. Sometimes it is alcohol. Sometimes it is dehydration. Sometimes it is a blood sugar swing. Sometimes it is anxiety. Sometimes it is sleep apnea. And sometimes, yes, it needs medical evaluation. So the goal of this video is not to scare you. The goal is to help you understand 4 common triggers you can begin addressing tonight, while also knowing when not to ignore it, because after 50 or 60 the body can become more sensitive. Your nervous system may not calm down as easily. Sleep may be lighter. Blood pressure may be higher. Medications may change. Hydration may be less steady. Blood sugar may swing more easily. And if your sleep breathing is poor, your heart may be working harder at night than you realize. The first trigger to stop tonight is alcohol close to bedtime. Many people use alcohol as a sleep aid without realizing it. A glass of wine, a drink after dinner, a little nightcap to relax. It may make you feel sleepy at first, so it feels like it is helping. But sedation is not the same as healthy sleep. Alcohol can fragment sleep, relax the airway, worsen snoring, and make breathing problems during sleep more likely in people who are already prone to them. The Sleep Foundation notes that alcohol can worsen sleep apnea because it relaxes airway support and can affect the body's response to breathing problems during sleep. And this is why your heart may race later. If your breathing becomes shallow or interrupted, oxygen can dip. Your brain senses stress. Your body may release adrenaline-like signals to wake you enough to breathe again. You may not remember a full awakening, but your heart does. You may suddenly open your eyes with your heart pounding, mouth dry, body tense, and mind confused. This is where people get fooled. They think alcohol helped them fall asleep, so it must be good for sleep. But the first half of the night and the second half of the night can be very different. Alcohol may help you drift off, then disturb deeper sleep later. You may wake at 2 or 3 a.m. with a racing heart, sweating, needing to urinate, or feeling anxious for no clear reason. And after 50, this can matter even more. Airway muscles may not stay as firm during sleep. Weight around the belly or neck can affect breathing. Menopause can change sleep patterns. Some medications can increase sedation. Blood pressure may be more sensitive. So the same drink that felt harmless years ago may affect your nighttime heart rhythm now. The practical step is simple but powerful. For the next several nights, avoid alcohol within 3 to 4 hours of bedtime. If you already have snoring, sleep apnea, high blood pressure, irregular heartbeat, or you wake up gasping, consider skipping alcohol completely while you track the pattern. Most people do not want to hear this because alcohol feels like relaxation. But if you keep waking with a pounding heart, the question is not, did it help me fall asleep? The question is, did it help my body stay calm while I slept? The second trigger to stop tonight is late caffeine and hidden stimulants. When people hear caffeine, they think coffee. But caffeine can hide in afternoon tea, green tea, chocolate, soda, energy drinks, pre-workout powders, some headache medicines, and even fat-burning supplements. Caffeine stimulates the nervous system. For some people, it can make the heart feel faster, stronger, or more noticeable. Mayo Clinic lists caffeine, nicotine, cold medicines, and energy drinks among substances that can make the heart beat too fast or irregularly in some people. This does not mean caffeine is bad for everyone. Many people tolerate morning coffee well. The problem is timing, dose, and sensitivity. After 50, caffeine may feel different. You may metabolize it more slowly. Your sleep may be lighter. You may be taking medications that affect heart rhythm, blood pressure, or anxiety. You may drink coffee to fight fatigue, then sleep worse, then drink more coffee the next day. That creates a cycle where your nervous system never fully powers down. This is where people get fooled. They say, caffeine does not keep me awake. I can drink coffee and fall asleep. But falling asleep is not the only issue. You can fall asleep and still have lighter, more fragmented sleep. You can fall asleep and still wake up with your heart pounding, because your body never moved into the deeper recovery state it needed. And hidden stimulants are even trickier. A person may stop coffee at noon but take a decongestant at night, or drink iced tea with dinner, or use nicotine in the evening, or take an energy supplement because it says natural. Natural does not mean hard neutral. Tonight, make the experiment simple. No caffeine after lunch. Avoid energy drinks completely. Be careful with decongestants or stimulant cold medicines, unless your clinician says they are appropriate. Avoid nicotine close to bedtime if you use it. And check labels on supplements that promise energy, metabolism, or fat loss. Most people miss this. The heart does not care whether a stimulant came from coffee, tea, a pill, a powder, or a healthy product. It only feels the stimulation. The third trigger to stop tonight is going to bed dehydrated or with unstable blood sugar. This one is quiet. You may eat dinner early, snack late, drink very little water, or have a high-carb dessert before bed. Then, hours later, your body may respond with stress signals. Dehydration can make the heart beat faster because there is less fluid volume for the cardiovascular system to work with. The body may compensate by increasing heart rate. You may wake up thirsty, dry-mouthed, warm, or with your heart pounding. But the answer is not to chug a huge bottle of water right before bed. That can wake you up to urinate. The smarter move is steady hydration earlier in the day, then a small amount in the evening if needed. Blood sugar swings can also wake the body. A late meal high in sugar or refined carbs may push blood sugar up, then insulin responds, and some people may experience a drop or stress response later in the night. This can feel like anxiety, sweating, hunger, shakiness, or a racing heart. It does not mean every nighttime palpitation is blood sugar. But if it happens after dessert, sweet drinks, white bread, cereal, cookies, or alcohol, the pattern matters. This is where people get fooled. They think I woke up anxious, but sometimes the body becomes anxious because it is reacting physically first. A blood sugar swing, dehydration, reflux, or sleep breathing problem can trigger a body alarm, and then your mind attaches fear to it. So tonight, avoid going to bed on a sugar spike. Keep late snacks small and balanced if you need one. For example, something with protein and fiber is usually steadier than cookies, cereal, candy, or juice. Avoid heavy, greasy meals right before lying down, because reflux can also cause chest discomfort and awakenings that feel frightening. Also, hydrate earlier. Drink water steadily through the day. If your urine is dark by evening, you may have waited too long. But taper large amounts close to bedtime so you are not waking up repeatedly to use the bathroom. This is a small habit, but it matters. Your heart likes a stable internal environment. Big swings at night, alcohol, sugar, dehydration, heavy meals, reflux, and stress can all make the body more reactive. The fourth trigger to stop tonight is ignoring sleep, breathing, and nighttime panic signals. This may be the most important one. If you wake with a racing heart and also snore loudly, gasp, choke, wake with dry mouth, wake with headaches, feel tired during the day, or have high blood pressure that is hard to control, sleep apnea needs to be considered. During obstructive sleep apnea, breathing repeatedly becomes blocked or reduced during sleep. The body may partially wake over and over again to restart breathing. This can activate the stress response and make the heart work harder. The CDC states that sleep apnea affects oxygen levels during sleep and is linked with higher risk of high blood pressure, heart attack, and stroke. This is where people get fooled. They think sleep apnea means they would know they were waking up. But many awakenings are so brief that you do not remember them. You just wake in the morning tired, foggy, dry-mouthed, or with blood pressure higher than expected. And sometimes you wake suddenly in the night with your heart racing, not because you had a nightmare, but because your body had to push itself out of a breathing problem. There is also nocturnal panic. Cleveland Clinic describes nocturnal panic attacks as sudden episodes that wake a person from sleep with panic-like physical reactions such as a racing heart, sweating, and difficulty breathing. Nighttime panic can feel terrifying because it seems to come from nowhere. But again, the important thing is not to assume. Panic, sleep apnea, reflux, arrhythmia, thyroid issues, medication effects, and blood sugar swings can overlap. The feeling may be similar, but the cause may be different. So what can you do tonight? Sleep on your side if back sleeping worsens snoring. Avoid alcohol close to bed. Avoid heavy late meals. Keep the bedroom cool. Give yourself a calm wind-down routine. If you wake up with your heart racing, sit up slowly, breathe gently, and avoid jumping straight into panic. Slow exhalations can help signal safety to the nervous system. But if this keeps happening, do not just manage it at home. Ask your clinician whether a sleep study, heart monitor, thyroid test, medication review, or blood sugar evaluation make sense. The American Heart Association notes that palpitations can come from many possible causes, and you cannot jump to conclusions without context. That is the medically smart way to think about it. Do not panic, but do not dismiss it. Now there is one more thing you must know. Sometimes a racing heart is harmless. Sometimes it is a short-lived palpitation, stress response, caffeine effect, alcohol effect, dehydration effect, or sleep disruption. Mayo Clinic says infrequent palpitations lasting only a few seconds often do not need evaluation, but frequent, worsening or concerning palpitations should be discussed with a healthcare provider. But some symptoms are red flags. If a racing heart comes with chest pain, severe shortness of breath, fainting, severe dizziness, weakness on one side, confusion, or a feeling that something is seriously wrong, seek urgent medical care. Mayo Clinic specifically advises emergency care for palpitations with severe shortness of breath, chest pain, or fainting. This is important because you do not want to turn every heartbeat into fear, but you also do not want to ignore a real warning. The key is the pattern. Did it happen after alcohol? After caffeine? After a late sugary meal? After dehydration? After a stressful day? After sleeping on your back? Does it happen with snoring? Does it happen with dry mouth or morning headaches? Does it happen with skipped meals? Does it happen after a new medication or supplement? Does your heart feel regular but fast, or irregular and fluttery? How long does it last? Does it improve when you sit up and breathe, or does it continue? These details matter. A helpful step is to keep a simple nighttime log for 1 week. Write down alcohol, caffeine timing, dinner timing, late snacks, hydration, medications, bedtime, wake-up time, symptoms, and whether you snored or woke with dry mouth. If you have a home blood pressure monitor, and your clinician has shown you how to use it properly, record morning readings too. If you have a wearable device, do not obsess over every number, but use patterns as clues. Most people try to solve nighttime racing heart with fear, but fear is not a plan. A pattern is a plan. Tonight, start with the 4 triggers. Stop alcohol close to bedtime. Cut off caffeine and hidden stimulants earlier. Avoid dehydration and sugar-heavy late snacks. And do not ignore signs of sleep apnea or nighttime panic patterns. Then support your heart with a calmer evening. Eat dinner earlier when possible. Take a gentle walk after dinner if safe for you. Keep fluid steady earlier in the day. Avoid doom scrolling or stressful arguments right before bed. Keep the room cool and dark. Practice slow breathing. Sleep on your side if snoring is an issue. And treat sleep like heart medicine, not just rest, because your heart does not only need care during the day, it needs calm at night too. And if you keep waking with a racing heart, your body may not be trying to scare you. It may be trying to show you that something in your evening routine, sleep, breathing, stress system, or metabolism is pushing it too hard. Listen early. Remove the triggers. Track the pattern. Get help when the signs are frequent, severe, or come with warning symptoms. Because the goal is not just to stop the racing heart for one night. The goal is to help your body feel safe enough to sleep, breathe, recover, and wake up steady again.